I now have Shoko from NHK. Shoko, are you on the line?
Yes. Can you hear me?
Yes, very well. Please go ahead.
Okay, thank you very much for taking my question, Margaret. Regarding the way of counting confirmed cases, the Chinese authorities said last month that they don't count confirmed cases who don't have symptoms as confirmed cases, but apparently there is a huge number of such without symptom cases. Given these facts, can WHO still make reliable global statistics relying on the data given by the Chinese authority? I mean, data not including without symptom confirmed cases. Thank you.
So I can start with that. So we have case definitions that we are using, which include a laboratory confirmation, regardless of the development of symptoms. What we know from case reports from several countries is that on the date of report, some patients may not have yet developed symptoms. And so they may be pre-symptomatic. We need to be very careful in our language here. The use of the word asymptomatic globally is, I think, not appropriate. And some people, most people who are identified as asymptomatic because they were identified as part of contact tracing, that means they're already being medically followed, and therefore they're being tested early. Many of those individuals who are listed as quote unquote asymptomatic are indeed pre-symptomatic, and they go on to develop symptoms a day or two later. What is really important for us in terms of our understanding of this epidemiology is when is transmission taking place and what are the drivers of transmission. From the epidemiologic data that we have, from the viral shedding data that we have, we know that the majority of transmission, the drivers of transmission for COVID-19 are people who are symptomatic. Now that includes people who are in the very early stages of symptom, and the viral shedding data supports that in the earlier stages of disease, when people are feeling just a little bit unwell, and they haven't yet had pneumonia, and they're certainly not hospitalized yet, those individuals are the ones that are driving transmission. So it is really important that we follow all of these measures where we keep our physical distance. Transmission of COVID-19 is through droplets. It is not airborne. Therefore, someone who has these small liquid particles that come out of their mouth, they travel a certain distance and then they fall. So that's why we recommend the physical distance to be separated so that you remove the opportunity for that virus to actually pass from one person to another.